Right, let's then turn to the first plenary speaker. An excellent start to the day, and I'd like to welcome onto the stage Shaun Lintern. Shaun is health editor of the Sunday Times. He's an investigative health journalist. He's been that for more than a decade. He's helped expose some of the worst scandals in NHS history, including the Shropshire and Telford maternity disaster and poor care at Mid Staffs, resulting in the public inquiry chaired by Robert Francis. Shaun is a strong believer in public interest journalism as a force for good. Shaun, we're delighted that you're joining us this morning, and I'll pass over to you for your talk on the role of journalism as a catalyst for improving patient safety.
Thank you so much, Richard, and thank you everybody for turning up and coming to hear me speak. It feels slightly odd for me as a journalist to be elevated to such a role as the keynote speaker for this morning's conference. I'm fresh back from a holiday abroad, which I've brought back a nice tropical cold virus. So forgive me if I'm extra nasally or have a sudden fit of coughs during this, but we'll see how we get on. But I think what I want to talk about this morning, as Richard said, this is the 10th anniversary for the conference. And if we go back 10 years, we return to a time when the NHS was gripped by the fallout from the Mid Staffs public inquiry. And that was something that was very close to me, and something that really catapulted me into health journalism, actually. So I thought I'd talk a little bit about that, and then a little bit about the role of journalism generally and in patient safety, and what I think is some good, some bad. I'm sure we'll pick up some of that in the Q&A, and I'm very keen to answer any questions and take the opportunity of grilling a journalist, turn the tables on me, so to speak. So I'll look forward to that later, but I've got a few slides to kind of guide us through this. But I'm going to try and not kill you by PowerPoint this morning. But we'll see how we get on. But thanks very much for the introduction, and just to run through this presentation. So I thought, first of all, as a sort of opening question, just for people to think, if we were doing this in person, I would ask you to raise your hands and sort of tell me whether or not you trust the media. And I work in an age at the moment when journalism is attacked regularly from all sides, and it's not a profession you join to be liked, and I've seen that very often. But I'm also, as someone working within journalism, very aware that many of my colleagues are actually dedicated to telling the truth, to writing stories that really make a difference and change the world. And I think it's an interesting question when you look at those trust tables and you see doctors and nurses at the very front, at the very top, and journalists way down at the bottom. So my morale is often affected by those. But I'm hoping when I've finished this talk, maybe if we were asked this question again, I'd be interested in what reflections we might get from the Q&A. And I'm certainly not going to pretend that all journalists are fantastic and brilliant and there are no problems in our industry. Like all industries, there are, but it's just an interesting thought and reflection, given that I'm being asked to speak today, and clearly somebody trusts me to put me in this position. So I always like to sort of start with this kind of discussion about trust. But of course, a bit about me. So that's basically a photograph of me in my office. Of course it's not, but that's the stereotype of a journalist, and I dreamed of working like that when I was a youngster and wanted this job, and had in my mind this role with a trilby hat, which I still don't have, actually. I need to get myself one. But I've been in this industry over 20 years now, and I describe myself as an accidental health journalist, and that's largely because of Mid Staffs. I was a bog standard journalist on a local newspaper in Stafford, or in the South Staffordshire region, the Express and Star newspaper, as was then very big publication. And I was covering everything from the church fates to the dog shows, and I just happened to be in the right place at the right time, really. And covering Mid Staffs has kind of shifted my entire world and viewpoint as a journalist. So it's catapulted me into this specialism, which at one stage I had said I would avoid. I wanted something much more sexier, like politics or crime. I've since realised, after more than a decade as a health journalist, there's plenty of crime and politics in health journalism. But I answered the phone to, or rather a colleague answered the phone to families complaining about Mid Staffs, and actually they didn't get anywhere with my colleague, but I was desperate for a small story. And so I said, can I ring them back? And we'll do a quick short story. And that was the mother of Bella Bailey, Julie Bailey, the daughter, sorry, of Bella Bailey, Julie, who went on to found the campaign group Cure the NHS. And I worked with her and those families over the following few years, along with other journalists, it has to be said, to expose the real disaster that was Mid Staffs. And when we think about Mid Staffs, there's where we are now 10 years on. I just wanted to sort of post this comment first and ask everybody to just read this and think about it. And it's a familiar quote, I think. And it could have been from any report since Mid Staffs. It could have been from the Mid Staffs public inquiry itself, maybe. I'm going to show you where it's from in a second. But this touches on a theme that I want to return to in this talk. And it's about how we keep hearing the same messages. And, we might say that now 10 years on from Mid Staffs, but really we could say that about Mid Staffs, because this quote, as good as it is about learning lessons and avoiding harm, it was actually written in 2000 in a report called An Organisation with a Memory, which many of you working in patient safety will be familiar with. So, we're 23 years on now from that report. Has much changed? Have we learned the lessons? Are we really getting to grips with some of these issues? And I think that's a challenge for the NHS and for people like me to actually think about, are we actually moving forward in any sense? But so Mid Staffs, people talk about Mid Staffs, and you often, because it's such a big, complicated disaster, and the public inquiry report itself was very dense with so many recommendations, and I think many people never actually read the report itself, but people attach their own different beliefs and views as to what may have caused Mid Staffs, including myself. We all bring to it what we think was the main cause. But one thing I wanted to sort of stress today was that disaster, really was a decade in the making. So in 1999, at the RCN General Congress, the then General Secretary actually referenced Mid Staffs in her podium speech to the RCN Congress, in which she cited that Trust's cuts to nurse staffing levels as being a risk to patient safety. So that's almost 10 years before the actual Care Quality Commission, Healthcare Commission report, as was then, which really blew up the scandal following some of the complaints from the families and the high mortality rates. So, a decade earlier, there were warnings about Mid Staffs. And again, in the years prior to the scandal being really publicly known, there were plenty of warning signs. The CHI, which was the Commission for Health Improvement, a sort of forerunner of the CQC, highlighted organisational challenges at that trust. And again, in 2003, there were concerns about A&E. And then you fast forward to the actual scandal and the fallout from that, and the A&E, it was again criticised for almost exactly identical concerns. And the A&E was closed overnight for some patients for a period of time as well. So I think we can look at different scandals, and I'll talk about some of them that I've been involved with, where you see the same signs coming through. And as a journalist, you report on each of the individual instances of news. And I think the lesson I've taken from Mid Staffs is that I was asked by the inquiry to look back into the archive of the newspaper, and there were so many articles pointing out risks and concerns and issues here, there, and everywhere. And I think no one's connecting the dots, and the journalists weren't connecting the dots. And in my journalism since Mid Staffs, I've tried to go after the systemic issues. I've tried to connect those dots. I've tried to ask the questions: what does this mean? How does this fit in? And that, I think, has been one reason why I'm sort of associated with so many big scandals, because I've been able to kind of make those connections. But here we are 10 years on, the victims of Mid Staffs, the families of those victims, can they be assured that we've really made any noticeable progress? And I think that's it's a question I'll return to several times during this, and I hope we will in the Q&A as well. I think there is a real challenge to think about this. And what came out of Mid Staffs was a real focus on patient safety. All of you will be familiar with this. I'm sure it dominated the conference 10 years ago, and it dominated conversation for a long time after. So I left the local newspaper in the Midlands and came down to London and worked for the Health Service Journal for many years. And my role there was covering in many ways the fallout from Mid Staffs, and it was the top of everyone's discussion points. Boards were having these conversations, trusts were thinking about this. Nobody wanted to be the next Mid Staffs, and that did have some real implications. So we did see record levels of staff recruitment, and that's continued. And if you look at the sort of date times, it's almost as soon as the inquiry had finished, and it was quite clear that nurse staffing levels was going to be an issue, all of a sudden NHS Trust started recruiting nurses like madness, and they've not really stopped. Now there's a whole other issue about whether we've got enough nurses, and we clearly haven't, and how that's been done. But the recognition of nurses as being safety critical really shot to the top of the tree, which it wasn't before, which I think was a terrible sadness and one of the key contributors to what happened. And I think all of us can agree, I'm sure, that there's been a huge effect on the policies, and the literally the laws of the land have changed as a result of Mid Staffs for the better. There are laws in place now, but I'm still very concerned, and I'm getting more concerned. If I'd have given you this talk 2 or 3 years ago, I would have said I'm concerned that we might see another Mid Staffs. And now, sitting here in 2023, I'm pretty terrified that that's actually happening in quite a few places. And I've reported in the last 2 years on some dreadful experiences happening right now, just because the system is suffering in the same way as that trust was at an individual level. And maybe we'll explore why that might be the case. So I just wanted to show this slide. This is something I've done in a few talks now, and it's a pretty shocking GIF. It's an image. I hope that's playing for you, but it's not real. It's a CGI image, but it's the classic, example of the scale of harm in the NHS, the avoidable deaths equivalent to a jumbo jet crashing every week. We're all familiar with that phrase, but here we are, have it in visual image, and this is the reality. This is what we're all trying to fix, whether as a journalist writing about healthcare and patient safety, or you guys working in clinical roles or in policy or in management. We're all trying to avoid this happening, and yet it's still persistently a problem. So where are we now, 10 years on from Mid Staffs? What are the current situations that the NHS faces? And I'm an observer. I have quite a privileged role to hold up the mirror to the NHS, and I've done that in several stories and scandals that I've exposed, and that's where I think journalism and patient safety connect. It's that holding up the mirror. So since Mid Staffs, what have I done? Well, I, as Richard said at the beginning, I was one of the journalists writing about Shrewsbury and Telford maternity problems long before anybody else was. So in 2015, I was contacted by the mother of one baby who died, who'd had an investigation, and she was convinced that there was more to this. And the response from the trust was really defensive and aggressive. And even then, back in 2015, still with Mid Staffs sort of fresh in my brain, I felt this felt very similar, not a million miles away either. And you fast forward to last year and the publication of Donna Ockenden's report into Shrewsbury and Telford, and you see so many of the similar issues we saw at Mid Staffs: the culture, the focus on targets and the lack of staff, etc., etc., and the scale of harm at Shrewsbury and Telford is unbelievable. 1,800 families involved, potentially 300 babies dead or damaged and brain damaged in some description. So there's a lot of similarities there, but that story got out because of families and because of journalists and because of people like me writing stories. And that was the same pattern with East Kent, where another maternity scandal that I helped to expose. Again, I'm not the only journalist that does this work, and there are many others. At Nottingham is another hospital I investigated when I was working at the Independent before the Sunday Times, and that's now facing a similar inquiry. And the reason I rattle all these off, although it sounds like I'm being very egocentric, the point really is that these things don't get exposed without families and journalists working together. And that worries me, because what's the system doing? Why isn't the system finding these problems? And I think that's the question for now. That's looking back at Mid Staffs and where we are now, and some of the scandals that can continue to be exposed by journalists and families. Why are we still stuck in that role? So laws have been changed. We've got new regulators, much more powerful laws in place. The CQC has much more stronger regulation now to prosecute trusts than it has done. But we also see some of the same old problems of regulatory bodies being more focused on their own reputation, having their own cultural issues. So the Healthcare Safety Investigation Branch, for example, is an organisation that I've been sort of semi-involved in helping to actually come to fruition with some of my articles, writing about that and calling for some level of independent investigation. But HSIB itself is now facing criticism and facing allegations and whistleblowers and cultural problems. And so these things are moving around. I mentioned workforce earlier. We've got record growth in nurses, but we know that more doesn't necessarily mean enough. And I get frustrated that the discussion around this is in pure numbers and not what's actually needed to match demand. And I think that's a perpetual problem we're stuck in. Where's the workforce plan? We've been promised it repeatedly. It was supposed to be out by the end of last year, then spring, then the budget. It's still nowhere to be seen. And until we get a grip of these things, I think we're stuck in a cycle, really. I think the other thing to mention is the digital technologies that are coming into the NHS now. They bring new risks and they bring benefits, certainly, and save clinicians time, etc. But there is an issue that I repeatedly see in reporting on coroners' inquests, for example, and the prevention of future deaths reports that are filed by coroners. Incidentally, another outcome of Mid Staff said that those are now published on the government judiciary website, which was never the case pre-Mid Staffs. And actually, one of the criticisms of Mid Staffs and the coroner there was that these reports weren't being tracked or seen by anybody. But they show repeatedly that task-based care, as I sort of call it, where we're splitting up the care of patients, continuity is being lost, people are falling between the stools, not being referred, emails not being sent, or technology getting in the way of people actually delivering safer care. And I think that's a real risk for the system. And then just lastly, the system capacity. So I've reported in the last since really the end of lockdown, the ambulance crisis, 4,000 people at its peak being harmed every month by ambulance delays. And I couldn't have done more to highlight this problem. It's been front page news, both when I was at the Independent and at the Sunday Times and in other newspapers as well. But the response from the system and from the government has been terrifying, really. The level of harm has been incredible, and yet the response has been quite muted, I think. So unfortunately, I think there's probably Mid Staffs are happening right now in probably several locations, and maybe even on a scale that was worse than Mid Staffs. And that's quite terrifying and kind of makes me feel like I've wasted the last 10 years trying to highlight this as a journalist and help to improve things. But maybe that's something we can reflect on in the Q&A. So Robert Francis led the inquiry into Mid Staffs, and I took the opportunity to sit down with him recently for the 10th anniversary of his report coming out, and I was really keen to understand what his take was, because I agree. I'm a biased journalist in many senses, that I will form a view from what I see in front of me, and I get that sometimes lacks context. Robert is quite analytical, and he's able to see the whole picture. He's regularly updated on his recommendations and how things are going. I have to say his views were pretty negative, and I just wanted to post this link here. I've tried to shorten it so you can scribble it down, but I'm happy to give it out to anybody who comes and asks me. But you can read my full interview with Sir Robert and all about his views now in March 2023, looking back 10 years for Mid Staffs and where we are now. But just as a little summary of what he said, I mean, one quote that he gave me was that the system is collapsing around our ears, and he's weighed down by this. He's thinking about it all the time. It weighs heavy on him, and he's been a bit like me. He became part of the system. He joined the CQC board. He's been part of Health Watch and the Patient Safety Patients Association. So he's got himself involved, because healthcare is like that, right? It gets under your skin when you start thinking about how people are looked after. And I think it's interesting that he's still bothered by what he sees and what he's hearing about. And he describes to me staff being in tears, staff still contact him with concerns, patients still contact him for help, which is incredible, really, when you think it's 10 years since his report came out. He tries to help, I think, where he can, but it's increasingly difficult for him. And you know, this I think was a key comment that he gave me in the interview, and it stuck with me, and I think it will resonate with all of you as well. That the real issue at Mid Staffs was that no one listened, either to the patients or to the staff, and I'm not sure we've made very much progress on that. And I think he's really hit the nail on the head. When you think about Shrewsbury and Telford, East Kent, Nottingham, you know, all the other scandals that we've had since Mid Staffs, you always find elements where staff were raising concerns, patients were complaining, but no one was listening for whatever reason, whether that be targets, finances, corporate self-interest, whatever the issues. And many of those were found at Mid Staffs. Robert's key point, I think, is right, that if we're not listening to the staff and patients and thinking about how we might respond to that, then we're doomed to kind of repeat those mistakes. So I wanted to just post very quickly my sort of summary diagnosis of what I think, why we fail to learn the lessons of all of this, what I see as a journalist in my reporting of different scandals, not just Mid Staffs. And, you know, it's quite obviously you do find examples of poor leadership and cultural problems that get in the way of actually finding out the answers for people and handling them properly. So we've got a duty of candor now post Mid Staffs. Is it always followed? Well, we know that it's not. I've reported on cases where there's been active dishonesty towards harmed families, and I think that's terrible, and that's still persistent in some places. It's getting better in others. This isn't to say everybody is the same, everybody's bad, everybody's good, but these are some of the problems I find. I think there's huge problems with the capacity to undertake investigations, but we've had HSIB, but it's kind of migrated cultural problems into it from drawing on some staff from the NHS. And so HSIB at the moment is in a bit of a turmoil and needs to sort itself out. But we can't outsource this responsibility. Trusts should be able to do this on a trust by trust level and be able to answer people's questions and come up with recommendations that make their care safer. And then you work through the others: poor communication, sharing of knowledge. I think, you know, I said earlier with the coroner's reports, it's regularly highlighted about the failure just to send emails or to make a phone call to follow up a referral. And people get lost in the system and it costs lives. And I think we need to think about this a bit more. And I think organizational memory is a key problem as well. People move around. Naturally they have careers, but they take their expertise. And actually, are we telling the full story? When we ask staff to read a guidance document and think about that, do they actually understand why that policy is in place? What was the harm that led to that rule? And are our rules and guidelines being created like that? Or are they actually just more for assurance and making individual policy managers and boards feel that they've done what they need to do. And the last one, probably slightly controversial for a patient safety conference, but I do think there is an industry around there, around audit and quality improvement, that sometimes I find is getting in the way of real learning. There's a lot of projects that don't follow the full cycle through. They again are used for assurance. They don't also involve patients often. They don't like the uncomfortable conversations and questions patients might raise. And I see a lot of sort of projects that, people suggest I should write about them. And then when I look at them, I think they're not really robust and good evidence. That this is purely my take on it. I'd be interested in what people think about it. I'm sure we could add many more. But I hope this was an interesting talk. I'm very interested to get to the Q&A. But this is where you can get in touch with me if you want to send me some abuse, send me some tips, and we can carry on the conversation a bit further. But I think we'll perhaps leave it there for now. And I'm happy for Richard to join us again, and we can have a Q&A perhaps, and we can discuss where maybe people want to talk about some of this, and maybe we can try and get some answers perhaps, because I think, as I've said, as a journalist, why I'm doing this and why I particularly are interested in health after Mid Staffs is to try and make things better, hold up that mirror. And I think we must all try and do that together. And I think if we can do that, if we can all coalesce around this and try to ask some of these difficult questions, listen to the patients, listen to the staff, we'll get to a better place. Thanks so much for your time this morning, and I hope you enjoy the rest of the conference. And let's have some Q&A. I think Richard's going to join us again, I believe. There he is.
Hi, Shaun. Thank you very much indeed. A very absorbing talk. Seems to me that just looking at your talk title, that really what the role of journalism the last 10 years has been holding up a mirror, but frustratingly for you, hasn't been a catalyst for improving patient safety.
No, it hasn't. It hasn't, Richard, and I'm really worried about that. When you think about the ambulance crisis we've seen in the last few months, it's absolutely terrible how many people have come to harm. But where's the concern about that? And that's quite worrying.
And you talked a lot about Robert Francis. For those people who joined the conference 2 years ago, we actually had Robert talking to us with the chair of the Patients Association. So he gave the conference many of the messages that you've given this morning. So do you want to just have a look? Would you like to have a look in the chat? There've been some comments there and some questions. Do you want to start picking them up? And I've probably got one or two afterwards that I can throw in as well.
Sure. Well, okay. Well, I'll pick up a few, and we'll see what we get. So I like the someone's posted the link to the interview. That's very good. Thank you, Laura. So there's a question here from Rosie. Have you looked at safety in other countries where healthcare is not free at the point of access? Is this a solution for improvement? Well, that's a great question, Rosie, because I have looked at safety in other countries. It's something I want to do more on, actually. But when you look at, for example, in America, and they're an outlier system, let's be honest, but they have the same problems. They don't have a nationwide system like us with a political top-down culture that's set from Washington, for example, because they have so many different providers and private providers, etc. But they still have a huge issue with avoidable healthcare. I went to a conference in California a few years ago, speaking to lots of the doctors there. And what I found fascinating was that they all said to me, we think it's fantastic that you've got this national system where if you find a problem, you can just mandate a solution and that will trickle down through the entire NHS and everybody will be better for it. And obviously I then laughed, and once I'd finished laughing for 10 minutes, I explained to them why, if only it was that simple. And I think really these are issues every healthcare system is battling with. Avoidable healthcare harm is an issue no matter what model of service provision you have. I don't think any one system is better than another, because when we're talking about patient-clinician interaction and system management, those problems are prevalent through all of them. I'll do jump in, Richard, if you want me, if you've got anything specific you wanted to raise.
I will, but do you want to just skim down and just take
Yeah,
another couple?
I'm
going to fight the corner of the Sunday Times in a minute. So,
well, I'm very happy to do that. I genuinely do not, but this is from Sarah White. I genuinely do not believe that health carers do not go into the NHS to cause harm to individuals. I'm concerned about the way staff are represented in the media. They are often vilified and have no choice but to leave their profession. Very sad. Well, I think that's a comment I hear a lot, Sarah. And, you know, as a journalist, I always point out to people, you will not find an article from me where I say that nurses are bad, nurses are killing patients, that doctors are not listening to patients. There's a generalization. I try to avoid those. When you write about a scandal, such as Shrewsbury and Telford, for example, you're writing about a specific incident, a specific issue, specific examples. And people often will then widen that out to say, well, that means all midwives. But I've never said that. And I think there is a problem that we have where people jump to those issues. We need to celebrate the good as well as the bad. And actually, I could do a whole talk about the challenges I have in trying to tell good stories. It's incredibly difficult to get really good stories out of the NHS. The NHS doesn't really know what a good story is, in my experience. Excuse me. But I think I take your point that there is issues there about how staff feel. And I think we need to make sure staff know that if they have no concerns themselves about their own practice, they'll be supported. But at the same time, we have to be clear that where there is poor care, there must also be accountability for that. And actually, if we're talking about accountability, the accountability I want is not nurses and doctors necessarily, but managers. And as Robert Francis recommended 10 years ago for regulation of managers, he still thinks that, and I'm broadly of the same view as well.
There's a question there, Shaun, about how can we make sure that learning is less transitory and really leads to sustained change. Can you wave any magic wands on that?
Yeah, it's a really difficult one, isn't it? Because I think the one issue I find is that everybody in the NHS wants to reinvent the wheel. They want to have their own project. And actually, what I'd like to see is a far more plagiarism in the NHS. Just copy the ideas and implement them. And I think there needs to be a repository of some evidence-based learning and improvement that's actually been shown to work. And I think that's where I find I get very frustrated that people claim things, but when you really look into it, it's not that clear cut. And I think it would be great to have somewhere a properly sourced evidence-based examples of things that have been shown and proven to work. At the end of the day, this is a science and it's a complex area, and people were going to move forward and backwards over issues. But I think that could be one way, perhaps.
Yeah, just following on from that, Alison says, can the media help us to describe solutions, not always more stuff? Can we inspire confidence a little more?
Well, that's really interesting, Richard, because the editor and deputy editor of the Sunday Times recently, about a year ago, gathered all the journalists together and said, we want to do more solutions-based journalism. They call it constructive news. It was interesting. You can imagine a whole room of Fleet Street journalists told to do constructive news. We all sort of scratched our heads and thought, what is that? And to answer that question, they brought a chap over from Denmark, I think it was, who's founded the Constructive News Institute to talk us through what is constructive news. And so we are actually trying to do that. And I've done a few articles for the Sunday Times where how it works is you identify a problem, you write about people trying to solve it in an investigative journalist way. This isn't puff pieces. This isn't writing about good news stories or, patients getting married on wards or horses visiting wards. It's not the puff. It's real rigorous journalism, but applied to some of the big issues. And the readers really respond to that. And there is evidence showing constructive news builds engagement with readers. And, as a subscription-based newspaper now, that's something we want to do. So I think you will see more of that. But as an industry, we're finding our way through it. We're evolving into a new form of journalism, I think, because there are other areas of the media which will do the cheap headlines, shock horror stuff, and that's what we're moving away from. So I think I take the point, and I think we get it, and we're trying to make that work. We are still always, though, going to be the holders of the mirror. We are always going to have to do that. It's a very important role. And as I've explained in my talk, without me doing that, Shrewsbury, East Kent, Nottingham, and many others would not be exposed, and those families wouldn't get the answers. So there is always going to be a role for that, I'm afraid.
Yes, and it's actually just popped off my screen. I'm just trying to find it at the moment, but there's another question saying, could journalism really be more positive rather than shocking the public about what's happening? But I guess if you're actually if you've got the mirror, if you're holding the mirror up, you've got to show what's actually happening, haven't you, before anything else?
But there's the other point I would add as well, Richard, is while I take the point that we need to be a bit more positive sometimes, and we are trying to be constructive, but we do still need to hold that mirror up. But also, it's not our responsibility to change the world or to make the system safer. We've done our job by presenting the facts as they are. Others need to then pick up that mantle, that responsibility, and take some action. And I think that's where I get quite frustrated that that's not happening at the moment.
Sean, that's great. There are one or two questions. We just ran out of time on your session. If you can maybe have a look at those, because there's some comments as well, which I think maybe you could take away.
I'm very easy to be found on Twitter and email and things like that. So very happy to continue the conversation with anybody.
Yeah. I mean, I'd just like to say that Sunday Times for me was the crusade by Harold Evans back in the I suppose the 1970s about the uncovering the thalidomide scandal that I really followed.
Harold Evans has been a professional icon for me, and actually I'm following in his footsteps right now at the moment, because the Sunday Times is running a campaign to get redress for the victims of sodium valproate, which has harmed thousands of children and babies, and that's an active area of campaigning for us at the moment.
So that's a really positive message to give everyone about the Sunday Times. And I think I would personally put politicians at the moment, or some politicians, way below journalists in the poll of rubbish people. So there you are. If that cheers you up as you go away, and
I'll take it, Richard. I'll take it.
Take it away. Okay, and if you can if you're able to stay at the conference, that'd be lovely. I hope you enjoy whatever you can see for the rest of the day, Sean.
Thank you very much. Thank you, everybody.
Thank you very much indeed. Well, we're just going to have a 5-minute break now before our second speaker.